So when else should you see a doctor? This is a list of what we as pharmacists would refer to as red flag symptoms. So when we're asking you about your symptoms before supplying a triptan, these would be some of the things we are looking for that would suggest you actually need to seek medical advice. So if you notice some of these things before you go in to get a triptan, then that, you might pick them up and decide to go and see the doctor yourself. If you don't, that's okay. Your pharmacist should ask you about your history and should be keeping these things in mind before they supply a triptan for you anyway. So if you get a sudden onset severe headache, that would be a reason to seek medical advice, because generally migraines don't come on, with the snap of a finger. There is a bit of a lead-up phase to that migraine. It sort of slowly kicks in. So if it comes on like thunderbolt, really severe pain instantly, that's unlikely to be a migraine. So we should get that checked out just in case there's something more serious going on. If you haven't had migraines before and you develop a new headache, particularly if you're over 50 years or if you're a carer for someone under 5 years and they complain of a headache at that stage, it's important to get that checked out because it's unusual for migraine to develop for the first time in those age groups. If you notice any neurological signs, so that's things like tingling in the hands or fingers, changes in your speech or sense, you smell things that aren't there, anything like that, changes in vision that are not part of your usual aura, then that requires investigation because some of those symptoms can be signs of a stroke and we want to rule that out as well. So if you do have an aura, which are usually visual disturbances, but they can be other neurological disturbances, make sure you are very familiar and you're comfortable with what's normal for you. And if it's just your normal aura, that's okay. But if it feels different at all to auras you've had in the past or you've never had an aura before, it's important to get that checked out. If you've got a headache that's worsened by coughing, straining, sort of posture, like putting your head down or exertion, then it's worth getting that looked at as well because that may suggest some pressure issues within the brain. And then if your headache symptoms change or the pattern changes like we've already talked about, or if you have any signs of meningitis, so fever, neck stiffness, and that sort of blotchy characteristic rash, or any signs of giant cell arteritis. So that's a condition where you get temple pain and jaw pain as well, or any recent head and neck trauma. All of those things would be reasons to get medical advice rather than self-managing with a triptan over the counter.